To date, over 450,000 people around the world have died because of coronavirus. But the BBC has found the pandemic's real toll is far higher. Analysis shows that another 130,000 people have died than would normally be expected if 2020 was any other year. This is what's known as excess deaths. Out of the 27 countries we looked at, Ecuador has seen twice as many deaths since the outbreak there began, with a 108% rise in the mortality rate compared to other years. In Italy, there was a 40% rise in the number of deaths, and elsewhere in Europe, the figures in Spain and Belgium were also disturbing. And 55% more people than usual died in Indonesia's capital of Jakarta. Sofia Betiza has more.
A father buries his youngest son. A mother, distraught. 3-year-old Rafa did not have coronavirus, but his parents say he died because of it. He had leukemia. When his condition got worse, his parents raced to hospital.
It was around midnight. The hospital said he would need to be tested for COVID-19 before he could be admitted anywhere. Another hospital told us there wasn't a children's doctor on duty, and the quick COVID tests they had were only being used for pregnant women.
Rafa's parents drove him to 3 more hospitals that night, with no success. The next day, they eventually found a hospital that would accept him, but he died before doctors could see him.
I still believe that if my son was given prompt treatment, he would still be alive.
Rafa is one of tens of thousands of people whose deaths are not officially counted as being caused by coronavirus, but are still victims of this pandemic. Since the outbreak of the virus, lots of countries are recording more deaths than usual. You can see a bump in the graph here. These are called excess deaths. Now, many of these have officially been linked to coronavirus, as you can see here in red. But that still leaves a huge number of lives lost, which are not accounted for in the COVID statistics.
Sofia Betiza reporting there. One of the countries we haven't included in our analysis is India, because we don't have good enough data yet. Even before the pandemic, only 70% of deaths in the country are formally recorded, and only 1 in 5 deaths are certified by a doctor. So far, India has recorded more than 12,000 coronavirus deaths since the start of the pandemic. But that is likely only a small part of the overall picture, because before you count even overall excess deaths in the period. Here's one epidemiologist in India to explain some of the reasons as to why the number of deaths in India has been relatively low.
So the deaths reported in India have increased over the last 10 years. It has increased from 69 to around 78%. So, and death registration is compulsory as per the civil registration system, which is mandatory for any passing of any inheritance. Therefore, it is followed in most urban areas. However, in rural areas, it is yet to pick up. So nearly 20%, there is an improvement needed there. As an epidemiologist, a trained epidemiologist in the University of California, Los Angeles, and working in India for a long time, I can tell you with certainty that we are not missing the numbers, missing a major number of deaths related to coronavirus. However, there are reasons why we are having lower number of deaths. Number one, younger population. Number two, we are still in the ascending phase or early phase of the coronavirus epidemic in India. As we move forward, we will get the numbers. Currently, we are around 9 per million deaths in India, which is approximately, much lesser compared to the entire world, which is having around 200 plus deaths. So we will have increased availability of data in the future. But more importantly, and this is my hypothesis as of now, Indians might have had cross infection with the other types of coronavirus earlier. Therefore, most young people would have had probably immunity for even the novel coronavirus. And only future examinations might reveal this.
That's Dr. Giridhara Babu there. In Russia, a health watchdog has reported that nearly 500 medics have died after contracting COVID-19. That's a huge increase from just over 100 doctors, nurses and other health workers who were reported to have died last month. Russian authorities say problems in supplying protective equipment were a contributing factor. Sarah Rainsford has more.
First of all, after this head of the watchdog, the health watchdog here, made this statement and talked about 489 medical workers losing their lives in this COVID pandemic, the watchdog itself then backtracked and said that these were not official statistics, that she was in fact citing an unofficial tally that's kept by medical workers themselves. But I think even so, it's very interesting that this watchdog, a very official body, is keeping clearly a very close eye on that unofficial tally. The official numbers for now are 3 weeks old. They talk about 101 medical workers having lost their lives so far. But even so, during this conference, it was a conference online about medical safety. The watchdog head talked about serious shortcomings that there had been, particularly at the very beginning of the outbreak of COVID-19 here in Russia, talking about the dire shortage of PPE and saying, was there more that we could have done to prevent medical workers dying? She said that was a question, and the answer coming from this official was yes, there was. And here there is a very clear political context for this. Just a week or so ago, Russia basically declared victory over coronavirus. There was seen to be a stabilization in terms of the number of cases being reported every day, and certainly the number of fatalities, specifically talking about here in Moscow as the heart of the epidemic. But that seems to be because there is a whole raft of very important political dates coming up. First of all, the Victory Day parade on the 24th of June, and then following that, a key vote for President Putin on constitutional reforms that will allow him to stay in power for another 2 terms. And it seems quite clear that the relaxation of restrictions that we've seen in coronavirus terms over the past few days, much more people on the streets, much more things opening up, is very clearly linked to the political agenda here. So there's a lot of concern that this opening up, whilst it's very welcome, people were very frustrated with the lockdown here, could very well lead to another increase in cases very soon.